Minister, there are women who are cancer survivors and who aren't able to use hormone-based drugs at menopause. The new drug, Veoza, offers a non-hormone option to them. The cost is prohibitive, and so can this drug be made available on the drugs payment scheme for them?
Deputy, for the question, and can I start by acknowledging your ongoing advocacy in terms of new medicines, including rare diseases, though obviously this isn't one of those cases. As the Deputy is aware, the HSE has statutory responsibility for decisions on pricing and on reimbursement of medicines. However, it's incumbent upon all of us, obviously, as public representatives, to be engaging with patients, to be engaging with clinicians, and to understand where the real opportunities are in terms of the future medicines. Veoza is a very new development for the treatment of moderate to severe vasomotor symptoms, apologies if I have pronounced that incorrectly, associated with menopause. As the Deputy will be aware, the Government is prioritising women's health care, including the provision of hospital-based services for menopause. The Deputy will be aware that critically, in terms of access to new medicines for this year, we have ring-fenced €30 million, 20 million from new development funding and €10 million from savings in the existing very substantial medicines budget of €3.2 billion. Veoza was authorised by the European Medicines Agency in October, so just in the last few weeks, or months rather. The company marketing it submitted its application for reimbursement to the HSE on the 8th of February. So the company has literally just put in its application in the last 2 to 3 weeks. So it's now at the first stage of the process. A rapid review by the National Centre for Pharmacoeconomics, and my officials and I will obviously be following this assessment with great interest, both in terms of the benefit that this drug can provide and because it fits importantly with our push on women's healthcare and our ambitions to have the best possible care in terms of women's healthcare right across the country.
First, I want to acknowledge that there is huge work having been done on women's health right across a range of different services, and that's very positive in IVF, in gynaecological services, for example, in Cork, and menopause clinics. And this measure would complement that huge effort that is being advanced in menopause clinics. There's a small number of people who are involved in it, and they have very limited, if any, options at all. And here, for the first opportunity, there is an option available, a non-hormone-based drug. Their options are limited because through their cancer treatment that they haven't been able to, or that they're not going to be able to use any hormone-based. So how will or can that inform the decision, the fact that it's a very limited alternative available to these people, can that inform the decision and to expedite the decision to bring it through to the DPS at a manageable price?
Thanks very much, Deputy. I'll walk through the steps and where it's at and where it's going. So, as I said, the company applied just in the last few weeks for reimbursement. That application is now undergoing what they call a rapid review at the National Centre for Pharmacoeconomics. The NCPE target is for 4 weeks for that. They don't always meet it. They're assessing an awful lot of new medicines. But that rapid review, typically the target is about 4 weeks. Now, following the rapid review, they may recommend a full HTA, a full health technology assessment, which takes a bit longer. They may not, but I'm hoping that they will recommend that this goes to a full HTA. That then goes to what's called the Corporate Pharmaceutical Unit in the HSE, the CPU. There was an ask put in as part of the budget for this year that we would sanction additional staff for the CPU for exactly this reason, so that we could speed up the process and so that we could assess more new medicines at the same time.
It's widely expected that it would be about April that this drug will become available to market and that people would be able to access it. So the timing on it is hugely sensitive and would be great for it to be able to have it right from the start on the DPS. Another very significant aspect, Minister, that I want to draw your attention to is that aside from the shock of a cancer diagnosis and the difficulty in dealing with the treatment and so on, there's also a financial shock to the person, and that once they've lost income, and once they've put behind them the cancer treatment, to be facing into the possibility of an expensive drug at menopause time is even more difficult for them at that stage. So the cost is hugely significant. Can a factor such as that be taken into account when you're setting the price at the DPS, bearing in mind that the people who will be using it have already had this difficult, expensive time on top of their difficult treatment?
Thanks very much, Deputy. In terms of the rapid review and then the health technology assessment, these are exactly the issues that will be looked at. How much would it cost the state if it is on the drug payment scheme, and what amount of good, essentially, will the medicine do for the amount of money that's being spent? That's the way we have to look at, obviously, all of the medicines. If it is recommended for the drug payment scheme, then you were saying €6,000. I'm not familiar with the figure, but let's say it is €6,000. The state pays nearly all of that, and what the patient is left with is an amount of just €80 a month, or much less if they have a medical card. But certainly, if it is recommended through the process for reimbursement, the vast majority of the €6,000 is paid for by the taxpayer, and then the individual pays €80 a month for the amount of time that they're accessing the medicine.